presenting on inventory management, which is part of the logistics channel, and the factor of concern is substitute products and how various firms can be able to manage these products differently. I have chosen research topic 7, part C, and the question is, how might hospital decision on substitute products differ from supermarket decision on substitute products? Firstly, I will talk about the importance of inventory management, identify inventory management special concerns, then I'll define substitute products, then distinguish hospital and supermarkets decision with respect to substitute products, and then provide an approach in managing inventory. To begin, since 1980, logistics system has drastically changed and improved over the years in the business arena, and it is one of the important activities in the logistics channel supply chain. A supply chain follows a pattern in response to customer demands. For example, if a customer consumes an egg in a day, the inventory of eggs would decrease at a rate of 1 egg per day. This person may end up buying a tray after 12 days. Now, inventory management is important because it improves customer service and it minimizes stocks. It also considers the cost of carrying or holding products, ordering products, and also cost of being out of products. It also helps in mitigating uncertainties and risk. Now, to identify inventory management special concerns. Now, there are special concerns in the control of stockouts and irregular demand patterns. For example, a firm may decide to minimize stockouts. This could be a great idea, but at some point in the supply chain, this may require a large amount of safety stocks, which is a concern and may cause imbalance in the inventory. Now I will define substitute products. Substitute products is the use of one product that satisfies the demand of a different product. For example, in a product level, one brand A pain reliever may be viewed as a substitute for one plan B pain reliever, or vice versa. On the another example would be at a product class where a potato can be substituted for rice. Now I will distinguish hospital and supermarkets decision on with respect to substitute products. From a supermarket's perspective, if a customer must have little or no hesitation in making substitution, but in some situation, if a customer feels irritable in making substitution, they may take business elsewhere, and this is a concern for supermarkets. So an example of finding a solution for this concern, supermarkets like Tesco have decided to have substitute products more accessible to customers by establishing express stores in local towns and city centers to meet the demand for customers. From a perspective of the hospital, the decision to the decision on substitute products can be challenging. Now, patients can tend to ask lots of questions like, does the substitute product pose safety risk, or is it compatible? In terms of blood supply, patients need blood for surgery or treatments, but if they experience a delay due to short or no supply of blood, this can be a concern for hospital. So an example, a hospital in India have decided to meet this demand by implementing the use of blood bank. So this can be able to cater for the demand in the event of an emergency. So they can use frozen blood to be substituted for fresh blood. So this allows for safety stocks and control of stockouts. Lastly, an approach to managing inventory, we will look at vendor managed inventory. This is a useful approach in managing and controlling inventory. This allows a firm to let manufacturers, or to allow manufacturers to access distributors and retailers' data so that they can be able to replenish their orders and control inventories. But this inventory has a drawback where there is an inadequate sharing of data between the relevant parties due to trust and control issues. To end my presentation, I would like to say that firms in different industries have various ways of managing substitute products in response to customer demand patterns. Thank you for listening.